Going to the doctor can be unpleasant, to say the least. A growing number of startups are trying to improve that. Startups get acquired all the time, but one acquisition is getting a lot of attention. Amazon just announced that it is buying the primary care provider One Medical. The deal is worth $3.9 billion. This would be Amazon's third largest acquisition, behind Whole Foods Market and MGM. One Medical is based in San Francisco. More than 700,000 members pay an annual subscription fee to access its network of clinics. They operate in more than a dozen cities, including Atlanta, Boston, Chicago, New York, LA, and DC. Companies like One Medical offer a boutique approach to primary care. They track patients with fully digital medical records. Members can use any clinic across the country, including for telemedicine or lab work, and they take a number of major insurance plans. Now, Amazon has tried to get into this business before. Last week, a company statement said that healthcare needs to be, quote, reinvented. But what will that mean for patients? Should a company with tons of data on your purchases also have tons of data on your health? And what will Amazon's business approach mean for patients? Let's discuss that with Christine Nordhelm. She's an associate professor of marketing at Georgetown's McDonough School of Business. Professor, welcome.
Nice to be here.
I will say, in the interest of full disclosure before we start, I am a One Medical patient, have been for a number of years, have been extremely happy with the care that I've gotten by and large. So I understand why Amazon wants to get into this space. Can you just give me your sense of what this acquisition could mean, not just for the company, but for this kind of, startup healthcare space as well?
Well, okay, so the healthcare segment is like catnip for all of the big four. Amazon, Google has tried to get into healthcare, of course. Apple is dabbling in it. Everyone's doing it. It's 20% of the GDP. It's the biggest segment that Jeff Bezos isn't in. He has the space, he has books, he has food, as you mentioned, but nobody's really in healthcare yet. So it's just a giant opportunity for any company with a lot of cash to throw around. From the patient's perspective or from the startup perspective, what Amazon brings is cash, or what anyone brings is cash. And that can help, especially the skills of Amazon can help to make things more efficient, more effective, and lower healthcare costs. So that would be the good news about Amazon getting involved. They are a logistics king. They know how to do logistics. They know how to take the cost out of systems. The possible downside is, of course, one is that they sometimes take the cost out of systems by squeezing the people who are providing that care or those services. And secondly, as you mentioned, there could be some privacy concerns.
What about the data privacy concerns in particular? I mean, the company has been kind of clear that it's going to abide by all the necessary laws. There are already fairly strict federal laws under a law called HIPAA that protects your health information, basically says nobody has any right to your health information unless you proactively provide it. But how much are the laws caught up to the possibility of what an Amazon or an Apple might do with our data?
They are not caught up at all. And honestly, the laws don't address the issues or the ability of any company, not just Amazon, regardless of this acquisition, to access your healthcare information either directly or indirectly. So let's say, for example, you have some back pain and you Google the symptoms. Well, if you Google those symptoms on a public browser, then everyone knows about it. If you visit the doctor and then get a prescription and then Google for side effects of the drug, then everyone knows about that as well. So none of those have anything to do with HIPAA or any privacy protections whatsoever. So even if I can't directly download your data from One Medical or access it through Amazon and One Medical, I can still pretty much know what's going on with you.
I wonder what your sense is of what this convergence of data and healthcare could mean. I mean, I mentioned last week that I had been knocked out for a number of days because of back pain. And I did some research while I was out to try to figure out, what kinds of muscle relaxers I might request in terms of things that might not make me as drowsy, that would allow me to stay a little bit more active. I can contemplate the value of having a large data set and the power of machine learning to help people like me make those sorts of decisions in an efficient, data-driven, research-driven way. And it feels like this convergence is going to happen anyway. How do you see this convergence going forward? More positive, more negative, too soon to say? How do you see it?
Honestly, in this particular area, I think it's a little more positive. We have to distinguish the consumer retail space from the healthcare data privacy space. In the consumer space, you trade privacy for convenience or possibly privacy for security. So I'll upload the information about what my automobile is in order to get the right tire that fits onto that car. And I'm very happy to share information about what car I drive in order to get that convenience of getting only the tires that fit that car. I'll upload my credit card information to a site if I trust that site and I believe that the credit card information will be safe. When we are working in the healthcare space, we're trading data for health, and that is a very different proposition. So if you don't share your data, or if your data isn't accessible, or you don't take advantage of internet research to check side effects and things like that, well, you may be putting your health at risk. And from a public health perspective, if data isn't shared, then we run into problems with the pandemic. We run into transmission of viruses that run out of control because we don't have contact tracing. So from both a personal and a public perspective, data sharing in the healthcare sphere might be actually a pretty good thing.
And what about the nature of the care itself? I mean, Amazon, as you mentioned, they're logistics giants. I can only imagine what it might mean for me having a visit with a doctor at a clinic if they're being timed down to the second in terms of their efficiency of dealing with me and moving through other patients the way that people say in an Amazon warehouse are tracked. The company has not said it's going to do that. But before I let you go, what do you think this might mean for the patient experience itself?
Right. Well, the patient experience might become more efficient. They might have better access to their own data, and all the data stuff, the back end stuff that Amazon does so well will be there. But you're absolutely right. Amazon doesn't have experience with front end retailer, and the experience they do have is not very positive. They don't have a core competence in that area. So that would be my biggest concern, that the actual face to face customer interaction, especially in the healthcare space, is something that Amazon doesn't have a core competence in and doesn't have any experience in.
But would this make it, very briefly, one last question, would this make Amazon kind of a first mover in this space? Does it have a lot of competition in terms of the level on which it's playing?
Everyone wants to be in this space. Everyone is trying to get into this space. Right now, it's super fragmented, and there hasn't been a clear winner that's emerged. But certainly the One Medicals of the world, the City Meds of the world, those are the companies that have direct contact with the consumers. He who has control over the consumer information wins. So Amazon is making the right play to have a win in this space. We'll see if they do it or not.
Associate Professor Christine Nordhelm of Georgetown's McDonough School of Business. Appreciate you helping us out tonight. Thank you very much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.